Most people who develop varicose veins follow the exact same path. First, a few spider veins appear. They seem harmless, so you ignore them. A little later, the veins become more visible. You try creams, gels, or home remedies, hoping they'll disappear. Then the veins start bulging. Finally, you schedule an appointment with a specialist and begin discussing treatment options. The procedure goes well, but a year or two later, the veins are back. That isn't simply bad luck. It's what happens when the visible symptom is treated while the real cause remains untouched. Here's what most people never hear. Varicose veins are not primarily a skin problem, and they're not just a vein problem either. They're the result of a breakdown in the system that moves blood efficiently through your legs. When that system begins to fail, pressure builds, circulation slows, and the veins gradually lose their ability to function properly. Once you understand what's actually causing the problem, you can start addressing it in a meaningful way. If you enjoy practical health information that focuses on solutions instead of quick fixes, make sure to subscribe and support the channel. Now let's start with the basics. What exactly is a varicose vein? A varicose vein is a vein that has stretched beyond its normal shape and lost much of its elasticity. Inside healthy veins are tiny one-way valves. Think of them as small doors that allow blood to travel upward toward the heart, while preventing it from falling back down. When these valves weaken or become damaged, blood begins collecting behind them. As pressure increases, the vein wall expands. Over time, the vessel becomes enlarged, twisted, and visible beneath the skin. What you're seeing on the surface isn't just a cosmetic issue. It's evidence that the valve system inside the vein is no longer doing its job effectively. To understand why varicose veins develop, you first need to understand the challenge your veins face every day. Your heart easily pumps blood downward through the arteries. Gravity helps with that process. But returning blood from your feet back to your heart is a completely different story. The body relies on two major systems to accomplish that task. The first is the network of valves inside the veins. The second is the muscle pump in your legs. Every time your calf muscles contract while walking, climbing stairs, or even shifting your weight, they squeeze nearby veins and push blood upward. The valves close behind the moving blood, preventing it from flowing backward. Then the vein refills and the process repeats again and again. This muscle pump system works thousands of times each day. When either the valves or the muscles stop functioning properly, blood begins to stagnate. Pressure rises, the vein walls stretch, and varicose veins start to develop. The three main causes of valve failure. Most people assume varicose veins are caused by age alone. In reality, there are several underlying factors. Excess pressure from above. The organs in your lower abdomen sit directly above the major veins responsible for draining blood from your legs. When pressure increases inside the abdominal cavity, those veins can become partially compressed. This creates resistance to blood flow. As blood struggles to move upward, pressure builds throughout the venous system below. Pregnancy can contribute to this. Frequent straining during bowel movements can contribute to this. Repeated heavy lifting can contribute as well. Anything that increases downward pressure inside the abdomen places additional stress on the veins in the leg. Weak vein walls. Vein walls are made largely from collagen and elastin. These are the same structural proteins that help keep your skin firm and flexible. Some people naturally inherit weaker connective tissue. As a result, their veins are more vulnerable to stretching and damage. These individuals often notice flexible joints, frequent sprains, or varicose veins developing at a relatively young age. Nutritional deficiencies may also play a role. Low vitamin D levels can interfere with collagen production. Chronic inflammation can gradually weaken vessel walls over time, and a lack of protective plant compounds known as bioflavonoids may further reduce the strength of the veins. Cause number 3, Thick, sluggish blood. Blood viscosity matters more than most people realize. When blood becomes thicker, it moves more slowly through the circulation. This increases pressure inside the veins and places additional stress on vessel walls. One of the most common reasons for increased blood viscosity is mild chronic dehydration. Not severe dehydration, just the everyday lack of adequate water intake that many people experience without noticing. And that's where the first step of the plan begins. Improve blood flow. Everything starts with hydration. For most people dealing with varicose veins, a practical goal is approximately 30 milliliters of water per kilogram of body weight each day. Water helps maintain healthy circulation and reduces unnecessary strain on the vascular system. And when we say water, we mean actual water. Coffee, soft drinks, sweetened beverages, and juices don't provide the same benefit. If you drink coffee regularly, simply make sure you're increasing your water intake accordingly. There are also several natural compounds that may support circulation. Turmeric contains curcumin, a plant compound studied for its anti-inflammatory effects and its ability to support healthy blood flow. Even a small amount added regularly to meals can become part of a long-term vascular support strategy. Another useful option is ginger. Ginger contains active compounds that may help support circulation and reduce inflammatory stress throughout the vascular system. One simple approach is ginger tea with fresh ginger and lemon, sipped gradually throughout the day. The key isn't taking large amounts at once. Consistency is what matters most. Next, we'll move to step 2, reducing swelling and fluid retention in the legs. Reduce swelling in the legs. This step is often overlooked, but it's one of the most important parts of improving vein health. When the tissues around your veins become swollen and retain excess fluid, they begin squeezing the veins from the outside. Imagine trying to push water through a hose while someone is pressing on it. Flow slows down, pressure increases, and the problem continues getting worse. As swelling increases, blood moves less efficiently. As blood flow slows, swelling often becomes even worse. This creates a vicious cycle that can continue for years if nothing changes. So where does this excess fluid come from? In many cases, diet plays a major role. Excess sugar, one of the biggest contributors to fluid retention, is sugar. When you consume large amounts of sugar, your body stores part of it as glycogen inside the muscles and liver. Every gram of glycogen holds several grams of water. The more glycogen your body stores, the more water your tissues retain. Excess sugar also contributes to chronic inflammation, which can gradually weaken blood vessels and worsen circulation. The problem isn't just desserts. Many people consume large amounts of hidden sugar without realizing it. Fruit juices, flavored yogurts, packaged sauces, breakfast cereals, and processed breads can all contain surprising amounts of sugar. Reading labels can make a bigger difference than most people expect. Food group number 2 is heavily processed food. Another major contributor is heavily processed food. These products often contain large amounts of sodium and flavor enhancers. When sodium levels rise, the body tends to hold on to more water. That extra fluid eventually ends up in the tissues, increasing swelling and placing additional stress on the veins. Common sources include fast food, chips, crackers, frozen meals, instant soups, and packaged snacks. Reducing these foods often leads to noticeable improvements in swelling within just a few weeks. Food group number 3, dairy products. For some individuals, dairy products may contribute to low-grade inflammation. This doesn't affect everyone equally. However, if swollen legs are a persistent issue, it may be worth removing dairy from your diet for several weeks and observing how your body responds. Many people are surprised by how much swelling improves during this simple experiment. Foods that may help reduce fluid retention. Fortunately, there are also foods that support the body's natural ability to regulate fluids. Examples include cranberries, lingonberries, parsley, celery, cucumbers, watermelon, and melons. These foods contain large amounts of water while also supporting healthy fluid balance. The key is consistency. Small daily improvements add up over time. Step 3. Activate the muscle pump. This may be the single most important step in the entire program, and unfortunately, it's also the one most people ignore. Remember earlier when we discussed the muscle pump. Every time your calf muscles contract, they help push blood back toward the heart. If those muscles aren't working, blood simply sits inside the veins. That's why varicose veins are especially common among people who spend long hours sitting or standing in one position. Office workers, drivers, hairstylists, retail employees, healthcare professionals, the common factor isn't age, it's lack of movement. When the muscles remain inactive for hours at a time, blood flow slows dramatically, pressure builds, and vein walls gradually stretch. The biggest myth about varicose veins: many people believe they should avoid exercise if they have varicose veins. That advice is completely backward. Appropriate movement isn't dangerous. It's part of the solution. The goal isn't intense workouts. The goal is regular activation of the muscles responsible for circulation. Certain activities are especially helpful because they repeatedly contract and relax the muscles of the legs. This creates a natural pumping action that improves blood flow throughout the venous system. 3 simple exercises for better venous return. Exercise 1. Sumo squat. Stand with your feet wider than shoulder width and point your toes slightly outward. Lower yourself slowly and comfortably. Then return to a standing position. Perform 10 repetitions. This movement activates the inner thighs, glutes, and pelvic muscles that help support circulation higher up in the venous system. Exercise 2. Standard squat. Place your feet shoulder-width apart. Lower yourself until comfortable. Then stand back up. Perform 10 repetitions. Focus on breathing naturally. Inhale as you lower. Exhale as you rise. Avoid holding your breath because that can increase abdominal pressure and place additional stress on the veins. Exercise 3. Calf raises. Stand upright. Slowly rise onto your toes. Pause briefly at the top. Then lower yourself back down under control. Continue until you feel the calf muscles working. These muscles are often called the body's second heart because of their powerful role in circulating blood back toward the chest. This entire sequence takes only a few minutes. Ideally, perform it several times throughout the day. If you spend most of your day sitting, even a few calf raises every hour can make a meaningful difference. And don't underestimate walking. A simple daily walk of 30 to 40 minutes is one of the most effective things you can do to support healthy circulation and reduce symptoms associated with varicose veins. Next, we'll cover one of the most overlooked causes of vein problems: mechanical restrictions that block healthy blood flow higher up in the body. Step 4. Remove hidden barriers to healthy blood flow. This is the step almost nobody talks about, and for many people, it's the missing piece of the puzzle. You can drink more water, you can improve your diet, you can exercise every day, but if blood is meeting resistance higher up in the body, progress may still be limited. To understand why, let's quickly review how blood travels from your legs back to your heart. Blood leaves the small veins in the lower legs and moves into larger veins throughout the thighs and pelvis. These vessels eventually connect to the body's largest vein, which carries blood upward through the abdomen and into the heart. It's a long journey, and along that route, there are several places where circulation can become partially restricted. When this happens, pressure builds below the blockage. The result is increased strain on the veins of the legs. Area number 1, the pelvic region. The major veins of the legs pass through narrow spaces in the pelvis. Chronic inflammation, scar tissue, digestive issues, or prolonged bloating may contribute to additional pressure in this area. When that pressure increases, blood flow from the legs becomes less efficient. Area number 2, the digestive system. Many people think digestive problems only affect the stomach. In reality, persistent bloating and constipation can create physical pressure throughout the abdominal cavity. When the intestines remain distended for long periods, nearby blood vessels may experience additional compression. This can indirectly affect circulation returning from the legs. Area number 3, liver health. The body's largest vein passes close to and through structures associated with the liver. When liver health declines and congestion develops, circulation throughout the abdominal region may become less efficient. That's one more reason why maintaining a healthy weight and supporting metabolic health can benefit your veins as well. Area number 4, the diaphragm. The diaphragm is the large muscle located beneath your lungs. Most people think its only purpose is breathing, but it also plays a major role in circulation. Every deep breath creates a gentle pumping action that helps pull blood upward toward the heart. Unfortunately, stress, poor posture, and long hours of sitting can limit diaphragm movement. When breathing becomes shallow, this natural circulation support system becomes less effective. #improving mobility and movement. One of the most practical ways to support these areas is through daily movement, walking, stretching, improving posture, deep breathing exercises, and gentle abdominal mobility work. These simple habits may help reduce unnecessary tension and improve overall circulation throughout the body. The important thing to understand is that improvements happen gradually. Problems that developed over years rarely disappear overnight, but consistent daily action often produces noticeable results over time. Step 5. Strengthen the vein walls. While improving circulation is essential, you also need to support the structure of the veins themselves. Healthy veins depend on strong connective tissue, and that requires the right nutrients. Vitamin D. One nutrient that deserves special attention is vitamin D. Vitamin D plays an important role in many systems throughout the body, including the maintenance of connective tissue. Low levels are extremely common, particularly among adults who spend most of their time indoors or live in regions with limited sunlight. A simple blood test can determine your vitamin D status. If levels are low, discussing appropriate correction with your healthcare provider may be worthwhile. Another important group of compounds is bioflavonoids. These natural plant substances help support blood vessels and may contribute to healthier vein function. Foods rich in bioflavonoids include blueberries, black currants, cherries, citrus fruits, buckwheat, and dark-colored berries. Many of the ingredients used in popular vein support supplements are derived from these same compounds. That's why regularly including these foods in your diet can be beneficial. What about compression stockings? This is one of the most common questions people ask. Compression stockings can absolutely help. They reduce swelling. They improve comfort. They support blood flow during long periods of sitting or standing. But they don't solve the underlying problem. Think of them as a support tool rather than a permanent solution. They help manage symptoms, but they don't correct the factors that cause the veins to become damaged in the first place. Used correctly, they can be very helpful. Just don't expect them to do the entire job on their own. When does surgery make sense? Modern treatments such as laser procedures, sclerotherapy, and vein removal techniques can be highly effective. They often produce excellent cosmetic results and can significantly improve symptoms. However, there's an important reality many people aren't told. If the underlying causes remain unchanged, new varicose veins may eventually develop. That's why some patients undergo treatment, experience improvement, and then notice new problem veins appearing a few years later. The procedure wasn't the failure. The system that created the problem was never fully addressed. For that reason, surgery is often best viewed as one part of a larger strategy, rather than the entire solution. When healthy habits, circulation support, movement, and lifestyle changes are already in place, Treatment results often last much longer. In the next section, we'll discuss blood clots, the real risks associated with varicose veins, what warning signs should never be ignored, and why varicose veins tend to progress more quickly after age 50. Blood clots, understanding the real risk. When people hear the words varicose veins, one of their biggest fears is often blood clots. Some of that concern is justified, some of it is not. The key is understanding the difference. A clot that forms inside a superficial varicose vein is known as superficial thrombophlebitis. This occurs when the vein becomes inflamed and a clot develops within it. The warning signs are usually easy to recognize. The vein becomes firm or rope-like. The area feels painful when touched. Redness develops along the vein. The skin feels unusually warm. If you notice these symptoms, contact a healthcare professional promptly and request a vascular ultrasound evaluation. Early assessment is important because it allows doctors to determine the exact location of the clot and whether additional treatment is necessary. The difference between surface and deep veins. One important fact often gets overlooked. The dangerous blood clots people fear most usually originate in the deep venous system, not the superficial veins visible under the skin. A clot that develops in a deep vein has a greater chance of traveling through the bloodstream and potentially reaching the lungs. This condition requires immediate medical attention. Fortunately, most varicose veins belong to the superficial venous system, which carries a significantly lower risk. That doesn't mean warning signs should be ignored. It simply means fear should be replaced with understanding. Knowledge leads to better decisions. Panic rarely does. Why varicose veins progress faster after 50? Many people notice that vein problems seem to accelerate later in life. There are several reasons for this. First, the natural elasticity of blood vessels gradually decreases with age. The connective tissue that supports vein walls becomes less resilient. Second, muscle mass tends to decline over time. Remember the muscle pump we discussed earlier? Less muscle means less assistance moving blood back toward the heart. As a result, blood spends more time pooling in the veins. Pressure increases, and progression becomes more likely. This process is common, but it is not inevitable. Daily habits can make a meaningful difference. The earlier you begin supporting circulation, the better your long-term results are likely to be. The complete action plan. Let's put everything together. 1. Stay properly hydrated. Aim for approximately 30 milliliters of water per kilogram of body weight each day. Consistent hydration supports healthy circulation and reduces unnecessary stress on the veins. 2. Support blood flow naturally. Include anti-inflammatory foods and spices in your daily routine. Turmeric and ginger are two commonly used examples that may help support circulation when consumed consistently. 3. Reduce foods that promote swelling. Reduce highly processed foods. Pay attention to ingredients that encourage fluid retention. If swelling remains a persistent problem, consider discussing potential dietary triggers with your healthcare provider. Increase daily movement. Move throughout the day. Walk regularly. Use stairs whenever possible. Avoid remaining seated or standing in one position for extended periods. Remember, movement is medicine for your veins. Activate the muscle pump. Perform simple exercises that engage the calves, thighs, and hips. Even a few minutes several times per day can improve circulation significantly. Improve overall mobility. Focus on posture, breathing, flexibility, and abdominal mobility. The body functions as one connected system. Improving movement patterns often improve circulation as well. Support vein strength. Maintain adequate vitamin D levels. Eat foods rich in bioflavonoids, including berries, citrus fruits, cherries, and buckwheat. Strong veins require the proper building materials. #8. Use compression wisely. Compression garments can reduce symptoms and improve comfort. Use them as a support tool, not as the only strategy. #9. Know the warning signs. Pain, redness, warmth, or hardening along a vein should never be ignored. Prompt evaluation can prevent complications and provide peace of mind. Final thoughts. Varicose veins are often viewed as a cosmetic issue. In reality, they are usually a sign that circulation is no longer functioning as efficiently as it should. The encouraging news is that many of the factors contributing to vein problems can be addressed. Hydration, movement, nutrition, muscle activation, circulatory support. These may seem like simple actions, but together they can have a powerful impact. The goal is not merely to treat a visible vein. The goal is to improve the system that created the problem. And when you focus on the system, long-term results become much more achievable. If you found this information helpful, consider subscribing and sharing this video with someone who struggles with varicose veins. A single piece of information can sometimes change the direction of someone's health journey. Thank you for watching, and I'll see you in the next video.